Today is June 12th, 2024. We're starting the Town of Bourne Board of Health meeting. It's 5:30. So just to be everyone's aware, the Zoom chat will not be monitored. Participants who wish to speak must raise the hand icon until the chair asks them to unmute. Note this meeting is being televised and recorded by Bourne Community TV for replay. If anyone in the audience is also recording or videotaping, they need to acknowledge such at this time. All items within the meeting agenda are subject to deliberation and votes by the Board of Health. If anyone from the public wishes to access the meeting remotely, they can do so by clicking the Zoom link or by calling the conference line, which is on the agenda. So first thing on the agenda is attendance.
Bob Collette.
Present.
Here.
And
Margaret Reale.
Miguel Prieto.
Barbara Princiata, and Dusty Myers is excused this evening. Second thing on the agenda is Board of Health meeting. So hopefully everybody in the town is aware. We have 2 new board members. We're excited to have them. One thing I know is they have medical background, which we're really excited about, but I'd like to introduce Margaret Reale. Maybe you can tell us a little bit about yourself or why you decided to do the run-in campaign or join our board.
No, it's on. Should
It's
be
on.
Oh, okay. Well, I was an RN. I was interested in public health. I have an interest in public health. And mostly, though, it's just that we heard that there was nobody running and felt it was, just wanted to help. That was it.
That's fabulous. That's actually how I ended up joining the board as well. So it's great to have you. Our other new member is Miguel Prieto.
Yeah.
So if you want to just give us a little brief about.
Sure, I'm a primary care physician. I practice lifestyle medicine, which is trying to prevent and treat and reverse conditions with lifestyle changes on food. So I just finished a cooking class now with a group of patients. So it was good. And, I wanted to participate in something after her prompting that I can give to the community. And it's not just about pills, but, if we can make changes that are for everybody's health.
Right. No, that's a great idea. I mean, yeah, if I'm thinking of it would be a good thing for all of us here on the board. We can have a little workshop, a healthy
Right,
workshop.
absolutely.
But no, that's such a great, we're so happy to have you.
Thank you.
So anyway, thank you. The next thing is the reorganization of the board. So there's 3 positions open. It's chair, vice chair, and clerk. Currently, I'm the vice chair, but every position's up for re-election. So for chair, I personally would like to nominate Bob for that position. He has a great background. He's knowledgeable in a lot of tobacco and other regulations, and he has a history with the Board of Health, so I'd like to nominate Bob. So anyway, if you guys aren't familiar with how boards work, somebody makes a motion, to nominate
I'll
somebody.
second.
Somebody else has to second, and then we vote on it.
Yeah, I'll second it.
Second. Okay, is anybody else interested in running for that, having that position? Okay, so then, can we take a roll call vote on that?
Sure.
Or all those in favor can just say
Aye.
Aye.
Okay, so Bob will be the chair going forward. The next position is vice chair. So I will say, I would like to have that position. I've been on the board quite a number of years, and I think I can be a value added to Bob, so.
I would agree. So I would, in light of that, I would nominate Barbara as vice chair.
Sure, I'll second that.
Okay.
So,
Aye.
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 okay, and then there's one final position, which is clerk. So,
Is that like secretary?
actually, Caitlin and her team is the secretary.
It is, so it's kind of just another position on there, yeah. We don't require you to take notes or anything, but
Right.
that would be essentially the job description, yeah.
So basically, when there's a board, if, for example, the chair isn't available, it goes to the vice chair. If the vice chair isn't available, it will go to the clerk. And then if the clerk isn't available, then, Caitlin's team takes with it. But generally, a lot of the things that come from the office, they're doing the paperwork for us. They're really, really so valuable to us. So it's a position that we have to have somebody fill, but I don't think there's a lot of legwork that you have to do on it. So since the 2 of you are here, Dusty,
Yeah.
if you would rather, I
No,
really.
I'll nominate
I
you.
completely don't care.
And I will second that. So we have Margaret Reale, so all those in favor?
Aye.
Okay, perfect, so the positions are filled. The next is committee appointments for the fiscal year 2025. So committee appointments, just like the reorganization of the board, is done every year right after the elections.
Yeah.
So right now, there's 2 Board of Health member appointments. One is the Bourne Landfill Business Model Working Group, and the other one is the Wastewater Advisory Committee. So currently, William Meyer, we call him Dusty, but everybody knows him as Dusty in the town, is on the Bourne Landfill Business Model Working Group. I can say Dusty has an extensive amount of experience with that. He's served on it this year. He's kind of like our go-to person a lot of times when it's all things septic and that type of work. So I would like to nominate him for that. I think he's a good person to fill that spot, and he's very interested in it. He
I
just
would-
can't be here tonight.
I'll second that nomination.
Aye.
So all those in favor?
Proceeding. Aye.
The second one is the Wastewater Advisory Committee. Last year, William Doherty served on that committee. I'm not sure, Caitlin, when was the last time they even met? It's a very infrequent.
I think maybe March. We do have, our CWMP plan is in the works right now, so I'm imagining there'll be a meeting that they'll review that as well, coming soon.
Yeah, so I would say, I would actually like to have myself on that committee, only because you do need knowledge of the CWMP and other things that are already happening within the town. And then, as you guys come up to speed,
Yeah.
you know, it's a good opportunity for you guys to maybe step in, depending on where you are next year.
Sure.
You know, but it does take a while if you're not familiar with the regulations to get up to speed.
Barbara, if I may, could we, just for the purpose and the sake of explaining what CWMP is to the new members?
Comprehensive Waste Management Plan.
Yeah.
So the town is required to have one, and they are in the process. We started it maybe 5 years ago, and then DEP came out with some new regulations, so it kind of threw in a wrench in our plans that we had established. So we're in the works of getting the recommendation plans from our consultants, environmental partners, and that will be before the select board in the next few weeks. And then it will go hopefully to town meeting. So it's kind of decides what route we want to take in the idea of protecting the environment from our wastewater. So, you know, do we want to do sewer? Do we want to go towards innovative alternative nitrogen removing systems? That type of thing.
Okay.
Okay. So, like I said, it's a big, you know, it's one of the biggest things happening in our town
Big
right
project,
now.
yeah.
So, it'd be good to have somebody with experience on that,
Sure.
unless the two of you say you
No,
have
I
the
think,
experience.
no, we're learning the ropes, so that's
Yeah.
okay.
Definitely.
And we are here, even Caitlin, I mean, they have a lot of knowledge, Bob has a ton of knowledge, so we're all here to support you and teach you whatever you want.
Yeah.
Great.
Note that you'll hear a lot of acronyms, so if you hear
Yes.
something,
That's-
we
yeah,
say
that's-
something, just say, oh, please.
Stop us, write it
Stop us,
down,
yeah.
I've
ask
been
us later.
starting to try to
Yeah, and you.
look them up, even the ones that are in here.
Yeah, and don't be afraid, to, like I said, I mean, Bob, thank you for, you know, bringing that up, but if you don't know an acronym, just say, excuse me, like, what is that? And,
Yeah.
you know, one of us will explain it to
Okay.
you.
Right.
So, yeah, so I guess I would like to nominate, appointment, you know, have myself do
Yeah,
that, so.
nominate Barbara for that, yeah.
All right. And then, the next thing is the agent of the Board of Health appointments. There's two. One's the Bourne Housing Partnership Committee, and one's the Local Emergency Planning Committee. Caitlin, has been serving on those since, for the past month or so, or a couple months. So, again, I think that she should continue with that appointment, assuming you're willing to take on that task for
For
us.
sure, yeah.
All right, so all those in favor of that? Aye.
Aye.
Okay,
May I ask a question?
Sure.
How many agents are there, or,
so Caitlin can speak to that, but we have one, Board of Health agent that is our, I guess, representative.
Yeah.
She's like, there's certain things that she does within the town that she has the authority to do. There's not many things that she can delegate to anybody else, to, pass on her authority. She doesn't have the authority to say, for example, somebody else that
Yeah.
works in the health department can approve something for us. So if something's going through like e-permitting or things like that, Caitlin has to give the sign off because she's our advocate, things like that.
And she's got certifications too that qualify her
Yeah.
beyond anybody else in
Right.
several areas. And then maybe after Barbara's done, maybe Katie, you could just explain the structure
Yeah,
of the
so the
department.
structure of
Yeah.
the health department is a health agent, we have an assistant health agent, a health inspector, and then an admin assistant. Currently, we don't have an agent, so I'm the assistant agent, so I'm the acting agent currently. And so, yes, I've taken on those roles. As the assistant agent, I did have those certifications, so it worked out.
Yeah, and hopefully they'll make that permanent for you. So,
Yeah, hopefully.
Right.
I know we're very pleased with you, so.
Thank you.
We've added this public comment on non-agenda items. I don't think anybody dialed into the Zoom.
Nope, just Stacy and Dion.
Okay. And then there's no one in the audience, so we have nothing there. And then the health agent's report, which would be you,
Yeah.
Katie.
So just a couple updates for you guys. The public bathing beach season officially started on June 10th, 5 days after our first sample was taken. And this year we have 9 public beaches, which include Barlow's Landing, Katomet Harbor, Electric Ave, Gilder Road, Monument Beach, Patchewisset, Picture Lake, Queen Sewell, and Sagamore Beach. 7 of those are all marine beaches. We have 2 freshwater beaches, and those are Queen Sewell and Picture Lake. We also have 9 semi-public beaches that are operated and the testing is paid for by those associations. The town just supports the actual testing and monitoring for them. So they have their own person that's in charge of responding. I will go out and post signs if there's any issues with any testing, so they don't have to as well. But that's up and running. In addition to our regular testing for enterococci and E. coli in the freshwater bodies, we've partnered with the APCC this year to continue our Association to Preserve Cape Cod, to continue monitoring cyanobacteria in our freshwater pods. So they will submit biweekly reports to us, which I included in your packet. I can provide them if you guys didn't pick them up. And they'll let us know what risk criteria those ponds fall in at that time, and if any action is needed from us. I believe that is all the updates I have on the beaches, if you guys have any questions.
Katie, can you send us all like a list of all the
Beaches?
beaches and
Yeah.
public bathing areas
Yeah.
with the addresses?
Absolutely. Some of them don't have real distinguishable addresses, but I will send you what I give our beach sampler.
Yeah, that'll be
Yeah,
fabulous.
I went on a nice tour. We had an old map that had like directions on how to get there for the county sampler.
Yeah.
And I'm looking at it as a town resident. I've lived here for quite some time, and I'm like, I don't know how to get to any of these places based off of these directions. So I went on a tour with the beach sampler and to create a better direction
Yeah.
for them. So they're narrowed down now. So a couple of them I have between addresses of where they're located. So I'll definitely send that over to you guys.
Yeah, that'll be great. At least we'll know.
So just quick question, the report, I thought that was excellent. I just didn't understand all of it.
Yeah.
What does BFC stand for?
Oh, that's Caitlin.
BFC PC average? Just makes it sound like the Picture Lake was quote-unquote cleaner than the other
Okay,
one?
yep. So it's just the type of cyanobacteria. I
Oh,
don't remember
kind
the.
of cyanobacteria. okay.
Yep, I'm not sure of the name specifically of that one. But there's a specific level of each that are allowed. Some of them are allowed to be higher because they don't have the neurotoxin that the other ones do. So,
Okay. Just that wasn't explained on the abbreviations.
Yes.
That's why. Okay.
I'll send you. And you guys too, because cyanobacteria is relatively a newer thing that we're monitoring. So I'll send you guys some more information on that as well. Any other questions on that?
I don't have any. Does anybody else have any questions?
So the last question, I saw you didn't mention, I guess I'm naive here, the dike. So
Oh,
that's not
yes,
part
it's-
of Bourne?
It is part of Bourne. It's not a registered bathing beach. So the town itself doesn't permit that location.
Okay.
It is,
It's one of the most beautiful.
it is one of the most beautiful.
Causeway.
But I think it is because it's technically owned by the Army Corps of Engineers,
Okay.
so we cannot physically permit it.
And the water doesn't get tested.
It doesn't get tested, so the best basis to go off of would be Monument Beach. We do have, it's usually 100 foot to 300 feet is how far you would not test between areas. So it's a little farther off than 300 feet.
But it's close enough.
It's close enough that you can kind of get a gist of what's in that little alcove area.
Okay, and do we know what the cutoff is for the cyanobacteria in here? So,
So it depends on the actual count that they have in in their samples, and also the scum layer that is visible as well on the, so that both those things would get taken into account for if it's an area of concern for them.
okay.
Any other questions? All right, so then moving on, it's the Health Department sponsored RFP for OUD needs assessment and implementation plan. Katie?
So we currently have a request for proposals out for an opioid use disorder needs assessment and implementation plan for the town of Bourne. The Health Department worked collaboratively over the last couple of years with the Bourne Substance Free Coalition to obtain access to the opioid settlement funds that were brought down from lawsuits to pharmaceutical companies. And we were awarded those funds at town meeting last year. So now we are taking those funds and figuring out a way to use them effectively. And we figured the best way to start would be to conduct a needs assessment to figure out where there are priorities in the town, what we're missing, what populations need to be addressed the most. So this request for proposals is due, the last day for submission is next week, I believe. And then we have a group of 5 people that will review those proposals from different departments, but different parts of the community. So we have someone from the school system, someone from fire department, we have someone from the Upper Cape community that also is a mental health counselor, myself, and the conservation agent who is an active member of the Bourne Substance Free Coalition as well. So we will review all the proposals and rate them and then award a contract possibly to someone who would then create a way to do a needs assessment, which will include surveys, questionnaires, in-depth interviews with people, key stakeholders. We'll do and encompass other data that we've had from other surveys in the past year from the state level and local levels to come up with what we need, and then they'll work with those key stakeholders. So we have, let's see, to address the concerns, town leadership, medical professionals, and general population will all be included in the assessment, and then also in gearing what those priorities should be and what methods we want to use to address them. So it'll be a long process, and it's going to be a plan that could take us a couple of years to get everything established, but it will also hopefully outline other means of funding to make it prosper longer as well. So we're very excited for that next step. And I will keep you guys updated on all of that stuff. And as the assessment process starts, I definitely would like to include the Board of Health in that as well. So
Yeah, that'd be great.
I think we should try, and it is a shame for the medical community that we're not more involved in this. A lot of our kids are dying from opiate overdoses, and if we're able to identify, I don't want to call them patients, they're not my patients, but, persons that are struggling with this, that we should be able to reach out to the community physicians and have them accept them and help them.
yes.
Since last year, the DEA removed the restriction that you have to have a special waiver to prescribe medications for opiate dependency, and so I used to have that, and they removed it. So it's just to increase access, and that has not happened. there's still a lot of stigma, and, you know, like, come on, if you have someone with diabetes, you go and help them, how come you're not gonna help this
Right.
other person?
Right.
Yeah.
So, and I'll be happy to, you know, be part of that and is not give the physicians guilt trip, but tell them, you know, we have to be part of the solution and we have to help the community with that. I'll be happy to participate with that.
Fantastic.
Absolutely.
That'd be great. Okay, Caitlin, do you have anything else on that?
I don't have anything else today, no.
Okay. And then we usually put on every agenda comments from the board in regard to future agenda items. We're not gonna put you two on the spot today, but, you know, just give some thought as you're starting to go through things or learn things. If there's something you're interested in adding to the agenda, you know, usually we bring it up at this agenda item. And then the sixth thing we have on here is approve the minutes from the May 16th, 2024 meetings. None of us have received those because they're still in process. Obviously, May was a busy month for everybody, so, you know, we should get those. Caitlin will provide those to us when they're
We would
ready.
need Dusty anyway,
Yeah, to have.
Yeah.
to have a quorum.
Yeah,
Yeah.
exactly.
Yeah.
And then this is a quick meeting because we don't have any applicants today. So the last thing is the adjourn. So somebody at the end makes a motion to adjourn and somebody seconds it. So,
I'll make a motion to adjourn.
Second.
okay, all those in favor?
Aye.
Aye. Okay, meeting adjourned.
All right, they won't always be this brief.